A drug intended to prevent HIV transmission will be covered under many health plans by 2021. And that expansion also means a generic, far less expensive version of this drug will be available in the near future. Denver 7's Lance Hernandez spoke with a man who knows the impact this can have.
I first started using PrEP in 2016. I was in a relationship with a man who was HIV positive.
Corey Walsh calls the reclassification of PrEP exciting news.
I think there's a misconception that people are not dying of AIDS anymore.
Before moving to Colorado, the 26-year-old was a counselor who helped those at risk.
I had a number of clients who I watched waste away and die because they couldn't get access to the drugs that they needed, or they were living and working on the streets.
He says the reclassification sends a message that HIV prevention is a priority. PrEP, which stands for pre-exposure prophylaxis, is a 2-drug pill that, when used daily, keeps HIV from replicating. In a news release, Colorado Insurance Commissioner Michael Conway says, "We commend the USPSTF for adding PrEP to the list of covered preventive treatments. This puts a highly effective medication within reach of those who need it, and it will save lives." But not every health plan will offer PrEP.
One of the gaps that exists is that it only applies to the plans that are offered on the exchange or Connect for Health Colorado.
Large employers, those with more than 100 employees, are not subject to the requirements of the task force. Still, Daniel Ramos at One Colorado says it's an important step.
There's still a lot more work to do to make sure that private plans follow the leadership of the Division of Insurance and ensuring that people can access the care that they need.
He says a generic version of PrEP due in 2020 will help lower costs, making it possible for more private plans to follow suit. Lance Hernandez, Denver 7.